All right.
Hello, Dr. Siddiq. How are you today?
I'm fine, Alex. How are you today?
I'm good. Sorry about the delay. We had a little bit difficulties, but I'm ready
That's
to get
okay.
started whenever you are. So if you're ready,
All right, we can get started,
sounds
Alex.
good. So I'm first
All
gonna
right.
introduce myself to the patient. So my name is Alexandra Sokolov. I'm an intern at Leadership Initiatives, and I'm going to be helping diagnose and treat her today.
All right. Yeah, all right, Alex, you can go ahead.
Okay. So could I ask what is the patient's name and age, and her yeah, and where if she works maybe?
All right. Let me give you the whole details in summary so you help me with the diagnosis, okay?
Sorry?
All right. Let
Could
me
you
give you
repeat
her
that, please?
details. Let me give you her details in summary so you can help me with the diagnosis.
Okay, sounds good.
All right. Her name is Abubakar Shafa'atu. Abubakar
Uh-huh.
Shafa'atu. She's a 35-year-old woman, a housewife. She presented with a 2-day history of fever. Do you get that?
Yes, I did. Could you repeat the last part though?
She presented with 2 days history of fever of 2 days.
Fever? Okay,
Yes, fever.
sounds good. So
And
has
then,
this fever, Shafaratu, has this fever been getting worse and worse recently, or has it been like on and off sometimes?
okay, fever is on and off.
On and off? Okay.
On
Have
and
you been
off.
experiencing any like headaches or nausea, anything like that?
Has headache, no nausea.
No nausea? Okay. What about dizziness? Dizziness or
No dizziness,
lightheadedness?
no lightheadedness.
No lightheadedness. Okay. Um, has she been experiencing any sort of diarrhea or constipation, abdominal pain?
No diarrhea, no constipation.
Okay. Um, how has she been coughing at all recently? Uh,
No cough, no chest pain, no body swelling, no difficulty in breathing.
okay, thank you. Um, how about has she been experiencing muscle pain or weakness perhaps?
Has mild muscle pains, no weakness.
Okay, sounds good. So just to recap, she said she's been feeling no lightheadedness, a little bit of dizziness, no nausea, slight muscle pains, and she's been experiencing a fever that's on and off. Is that correct?
Yeah, very correct.
Okay, thank you. So, could you please let Shafara to know that I would like to run some tests on her, and could you ask if that's okay with her?
All right, we have a test result here. I should go ahead and tell you. I should spill it.
Okay, so could I please request a rapid diagnostic test for malaria on the
Of
basis
course,
of,
Alex.
sorry?
Go ahead.
Oh, okay. I would like to request a rapid diagnostic test for malaria on the basis of her intermittent fever and also her dizziness as well and muscle fatigue.
Okay. All right, so you have a rapid diagnostic test for malaria, which was
Sorry, could you repeat that?
a rapid diagnostic test that shows positive for malaria, and the
Pos-
two pluses of malaria.
2 pluses of malaria?
Yes.
Okay, sounds good. And just to recap, she said no lightheadedness whatsoever.
No, like
Okay. Just to make sure, could I ask what the patient's diet might look like currently?
It's mainly tropical. Um, um, Grains, carbohydrates, which is mostly rice, um, vegetables.
Okay. And you mentioned earlier that the patient, Shafaratu, is a housewife. Could I ask if she lives in a region that's close to like an open water source where there may be many mosquitoes, or if she's around lots of people all the time?
Yes, she lives in a swampy area. Husband is a
Okay.
farmer.
I see, a swampy area. So uh, along with the tests, I believe that the patient has uncomplicated malaria with pluses, but just to make sure that it's not complicated malaria due to anemia, could I ask you to check if the patient is pale in any way by comparing your hands with her hands?
Okay, bye, honey. All right, this is your comparison here.
Okay,
Patient
thank
is
you.
not pale.
Thank you very much. Okay, so I do not believe that she has
All
anemia
right.
because she has not been experiencing lightheadedness or anything of the sort. And typhoid also seems to not be an issue because she has not been experiencing any abdominal pain, and she also does not have any diarrhea or constipation. So, along with that, she has not been experiencing any coughing, so I've taken ARI out of the question. So, I would like to diagnose the patient with uncomplicated malaria with 2+. So pretty much, could you let Shafara to know that what malaria is a disease that is transmitted by female mosquitoes. So the way to prevent that is by wearing long sleeve clothing. But I understand that in areas such as this, it may be a little bit hot. So let her know that if she has any sort of insect repellent, that would be very, very helpful. Also making sure that when you go to bed, you have mosquito nets over there. So any sorts of things that could repel mosquitoes are very helpful in preventing malaria. Could you let her know that?
Sure, sure, sure. So how would you treat her?
Oh, so for treatment, I haven't gotten to that yet, sorry. For uncomplicated malaria, the way you would treat it is through oral ACTs. If it were complicated, we'd have to use IV artesunate, but for now we can use oral ACTs, okay? And also make sure that you're hydrating properly, okay? And getting some rest so that you can let your body recover. If since she's been experiencing a fever, I would also like her to take some antipyretics to lower that fever. Does that sound good?
Sure, sure. That's
Okay, of course. Could
wonderful.
you let her
No
know
problem.
that?
No problem, Dr. That's very correct, Alexandra. Performance was excellent.
Sorry, what was that? Dr. Sadiq, could you repeat what you said, please? Hello?
Hello, Alex, can you hear me?
Hello, Dr. Sadiq, can you hear me? I can hear you.
I can hear you. Can you hear me?
Yes, I can hear you now. Could you repeat what you said just before? Seems the screen is frozen. Yeah. Maybe their video.
Hello,
Hello,
Alex?
Sadiq? I can hear you now again. Hello?
I think the network, there's poor connection today.
Sorry, could you please repeat that?
I said the connection today is poor. Connection.
Oh, I see. Poor connection.
Yeah. All right, Alex, you did very well. You performed wonderfully well. Thank you very much for helping me diagnose and prevent malaria in my patients and also treating malaria.
No problem. Could you please tell Shafar too that I hope she has a wonderful day and she gets the treatment that she needs.
All right, we'll do. You too. Do have a wonderful day, Alex.
Have a
Thank you very
wonderful
much.
day, Dr. Sadiq.